I remember seeing a news story last week about a person who was very much an anti-vaxxer who got COVID and died. And as a tribute to him and to educate those who knew him and came to the funeral, they actually had a vaccination center, or site set up at the center, and they wanted people to get vaccinated as a tribute to this man who was dead set against vaccination. And then, that sent a pretty powerful message. It's tragic, but it sent a powerful message. And I understand that a lot of people at that funeral did get vaccinated.
I'm Susan Spurlock, Executive Director of Ford Hall Forum at Suffolk University, and I'm delighted to welcome you into our virtual space for this evening's program, Getting the Word Out. How do we communicate during a pandemic? It is now my pleasure to introduce Christina Coolidge, a faculty member in Suffolk University's Political Science and Legal Studies Department. Christina?
Welcome everyone to the third episode of our survey course for everyone. Tonight we'll be talking about a really important aspect of public policy, and certainly during the time of a pandemic. So as political scientists, we are really, really interested in the nexus of how policy impacts behavior ultimately. And a fundamental piece of that puzzle is how complex information, whether it be about regulations or the latest public health guidance, is really important. And we all know that we're living in a vastly changed media landscape with, unfortunately, tons and tons of mis and disinformation. We also know that the power of media is exponentially increased over time. So certain influencers can get out there in front of the public and change what it is that they do. So I want to share my screen with you in order to show you a little bit about one of the things that is super complex about sharing scientific knowledge and the most recent or the most important public health information. Some of you may have heard, and we didn't plan this, but it's actually perfect as a way to launch this program. CDC has come out yet again with new guidance about wearing masks that's based on the community that you're in and risk levels in terms of the spread of COVID in the community where you are. And this is broken down essentially to a county level. So what you're looking at is an interactive map, and we will drop the link to this into the chat if you want to explore it yourself. And what it shows, put up on the CDC main website, is a county by county breakdown of COVID vaccinations compared to social vulnerability by county. So if you are in a place that has this purple color, high social vulnerability and high vaccination, you're probably in a pretty good place. If you are in a place with these lower volume colors, you're probably in a place that has a higher risk level, right? So that's complicated, and that's changing all the time. And we can talk about why we don't have much information from Texas. That could be another whole episode. But the point here is that there are a couple of challenges to communicating complex information. One is that it is changing all the time, and it requires people to think. So we have an expert panel here tonight, public health experts, infectious disease experts, a communications professional whose entire job it is to try and break down complex scientific concepts and make them understandable by a general audience. We also have an academic who studies the spread of mis and disinformation through social media channels. And we have a fabulous moderator, Heidi Legg. to whom I'm going to turn the panel over right now to get started. Heidi, take it away.
Thanks, Christina. Hi, everybody. Welcome to our talk today on the GBH Forum Network. I love the mission of this network, and I'm really glad you're here tonight because, folks, we're back in it. Things are getting difficult again with COVID, and we're going to have a very important conversation tonight about how we move forward as a country. I'd like to introduce the guests tonight on the panel. Peggy Slasman is Senior Vice President for Public Affairs at Massachusetts General Hospital in Boston. Dr. William Schnaffer is the Professor of Preventative Medicine and Infectious Disease at Vanderbilt University School of Medicine in Nashville, Tennessee. And Jonas Kaiser is Associate at Harvard Berkman Klein Center and Assistant Professor of Communication, Journalism, and Media at Suffolk University. So with that strength of a panel, we have a problem at hand, everyone across this nation, at protecting everybody and moving us forward as a nation. And I want to ask, and I think I'll start with Jonas, because you're watching the media stream. Where are we with things? How's it look out there today, this afternoon, at this minute? What are you seeing?
I think the answer to that question is probably it depends. More specifically, it depends on in what kind of landscape or ecosystem you're traveling, so to speak. Meaning that a polarization in the US has kind of like led to people being encapsulated in very different, I will not say realities, but like the news that you consume will be very different. And so if you kind of like follow more like the mainstream media news, you will, for example, have heard with good information usually about the CDC's new mandate, right? Whereas, for example, if you're more leaning to the conservative side, you might have heard that maybe too, but in a very different light. And of course, this transpires to social media as well. And so, yeah, it depends on where you stand and where you get your information from.
I want to come back to that and the divisiveness that's happening in our political space with just our information stream. But Dr. Schnaffer, can you tell us what you're seeing today?
Well, it's been very busy, Heidi, because any major change, such as those recommendations from the CDC, raise many questions. And as Christina suggested, it's a bit complicated. The CDC's messaging is not, it doesn't follow the rule of KISS, right? Keep it simple, stupid.
Right, exactly.
The epidemiologists try to be very precise. And in that precision comes a variety. And with variety, it's much more difficult to communicate. And so I've been spending a good part of the day trying to explain what the CDC's guidelines really mean and the thinking behind them.
You know, the media stream moves very quickly. It always did. News always moved fast. You always had to make choices in a newsroom of what stories you're going to put forward at the top of the hour, but it moves even faster today. Just last week in Tennessee, you're the medical director of the National Foundation of Infectious Diseases, and Tennessee blew up because the infectious, the title, you'll have to help me with Michelle Fisk's title, but she was ahead of vaccination in Tennessee and you know, she was fired. So how's that going down there now? Has that changed? Are we on to something else?
Well, Michelle Fiscus, who was the director of our state's immunization program, was summarily relieved of her position. And it has widely been publicized that it came because of conservative legislators. She had a terrific amount of support throughout the state from the providers. She kept them informed, really directed the immunization program, not just having to do with COVID, but all immunizations with real intensity and professional commitment. She made the mistake of transmitting a cleared statement back to some providers saying, yes, in Tennessee, children 14 and older could give their own independent consent for vaccination. Mind you, this was based on a circumstance that
1987 Supreme State decision.
the Tennessee Supreme Court validated that, and she was just passing that along. Conservative legislators objected to that, and that resulted in her being cashiered. And that caused an enormous amount of tumult here, and actually was widely reported throughout the country, causing a lot of embarrassment. And basically, the state has been trying to recover ever since and reassure people that their immunization programs continue unabated.
I want to come back to this with both you and Jonas in a moment, because I want to talk to Peggy first that links to this. But what I found interesting in the story in Tennessee is that actually 40 states in America, the kids have to have the permission of their parents if you're 14 to 18. It was just that Tennessee had this obscure thing in their state where you could get around that and be a mature minor. But I want to come back to that with you and Jonas about how something small like that just blows up the whole information stream and gets us off target. So turning to you, Peggy, Mass General, and many of the scientists and hospitals in Boston, thank you. For those of us who live here, you've done an incredible job. Our vaccination rate is very high. We got through some very tough times at the top of COVID. Maybe you could talk to this about even youth vaccination and vaccinating kids in schools and how Massachusetts has been approaching this pandemic, because I think Massachusetts maybe has something to share for some of these states who are all of a sudden in deep trouble again.
Yeah, absolutely. And we love it when we get calls and we're asked to share what we're doing in Massachusetts, because I think it is a state that has a high rate of vaccination. I think we have a lot of medical experts who have been on the front lines answering a lot of the questions that are coming up, or providing science-led information and sound information. I also think that that some of the communities we've been serving are diverse communities. They don't always speak English, and so the challenges of communicating have been pretty extensive. And we have a lot of experts who have been very willing to like Dr. Schnaffer has been throughout the pandemic, to kind of lend their expertise and help sort through this and provide some context to this very confusing and complex information.
But Peggy, Massachusetts has, there are many states who've done such a great job, even, out on the West Coast, a couple of the northern states were hit very early and dealt with this. What were some of the things that happened from an organizational level for the state and the institutions coming together that really worked? Where, you've got a bit of distance because we're vaccinated, our numbers have calmed down in the hospitals. When you look back at the last sort of 18 months, what are some of the key things that you're like, gosh, I really wish other states would do this?
Well, we got slammed early. We had an international conference that took place in Boston, and that was one of the super spreader events that I think we all heard about. And so I think we had a lot of lessons that we learned early. And our Governor Baker, was out in front, daily press conferences. We were then tasked with talking about the latest information with our audiences, starting with our internal audiences, because our patients and families were asking a lot of questions, and we wanted to arm everybody in the institution with information that they could respond appropriately. And then nationally, we have been trying to talk about the Massachusetts experience, and have been very trying to do as much on social and through our media relations program. We've also invited reporters in to kind of show them what we're doing, to talk to the experts and to share information.
But before I leave you, I can't remember. I know that some of my kids, there was an option to go get vaccinated at their schools. Were we vaccinating in the schools before school let out? And will we be vaccinating the schools in the fall? I mean, are there simple things like that we're doing that other states could adopt? I'm looking for some actual tacticals.
Yeah. I don't know. My focus was not as much on the state side as it was on taking the information that the state and the city and others were releasing, and trying to make sure that the media had as sound information as possible.
Dr. Schaffner, you are sort of a pro at helping the vaccine hesitant to come to the table, and somebody who's nervous, or they're maybe they're just skeptical. Maybe for some reason they culturally don't trust, the healthcare system. It's failed them before. It's tricked them before. They feel nervous about being the experiment. They're listening, as Jonas said, to sort of a certain silo of media that's telling them to be nervous. How do you talk to people? How do you convince people that this is really in their best interest, that it's not only, for their health, but for the freedom and the innovation and the moving forward of our entire country to be back on its feet? How do you talk to people?
Well, let me mention it personally and then more on a population level. Personally, first of all, there's no question that shouldn't be acknowledged, and the questioner has to be respected. And the first thing I always say is, being skeptical and hesitant, that's normal. That puts the patient at ease. And then
you're talking to a journalist, Dr. Schaffner. We're skeptical of everything. And in full disclosure, my husband had to make my appointment for the vaccine, that we're always questioning everything. And there are people who are just, that's just their style, is to be skeptical. So no shame in that, right? You don't.
Right. Absolutely. You have dissing the patient will never work. So you have to let the patient know that you've heard them, and then you ask them what their particular concern is, and then you try to engage them in a conversation about that. And remember, changing behavior, facts are necessary. They go to the brain, but people's attitudes have to change before their behavior changes. And that means it's what they feel about it. Are they comfortable? Are they reassured? What are their peers doing? And so you need to make them comfortable in their decision. And when you think about trying to do that on a population level, you realize that there are many different subpopulations. And what you like to do is get trusted, very important word, trusted messengers that look like the population that you're trying to reach out there communicating. And they can be local faith leaders, they can be local politicians, people from the business community, leaders of the local Lions or Rotary Club or something like that. Depends on the group you're trying to reach. And if you're trying to reach underserved populations, you need to get people who are African American, Muslim, Hispanic, talking to their separate communities. Always try to get people who look like them and who are trusted by that community.
I have to say, it was one of the things of the panel, we all looked alike. And I thought to myself, how do we instill trust if we don't have enough diversity around us? And I think, so many people are aware of that now. We're trying to get into communities and amplify inside the community, but it's really hard. And Jonas, you're looking at that from the media. We're being siloed into these narrow media tunnels, and it's really hard to break through. What kind of advice do you have for us around that?
Well, I mean, it's one side that we're siloed. We also do the siloing ourselves, right? So basically, it's kind of like we always also choose what news we read, where we do get our news sources from, et cetera, right? And I think one tip in that regard, more generally speaking, is just like to be aware that there are other ways to look at the world, just like generally speaking. And that generally speaking, again, the perspective that we're getting, be it on social media or, like on one news source, is rarely, if ever, kind of like representative of the overall discussion and the overall public opinion. And so it's important kind of like to be aware and to listen to other sides, right? Like, of course, that doesn't mean, you have to trust everything, etc. That is like a whole different ballgame. But basically, to first and foremost know that whatever you get is not what everybody is getting.
And what about the fact that, we're seeing regulation trying to happen in DC? Who knows if it'll ever happen? As you know, I study a bit of this space too at Harvard. And it's very frustrating because nothing seems to be moving fast enough. But, there's a couple stats. YouTube, there's this sort of the dirty dozen anti-vaxxers. These are, for those of you who aren't familiar with this, they're sort of like were these 12 sources that were spreading a lot of the anti-vax information. The platform said they were on top of it. But if you go on YouTube, those videos can still be found. Facebook says it gave 25 million to news. So they did, not that they said, they actually did give 25 million for COVID news to try and help bolster during the pandemic. They said they pulled down millions of posts that are around discouraging the vaccines, and yet Facebook group pages are still spreading these lies, or if you want to call it disinformation, misinformation, I call it lies, but whatever. And then you have influencers on social media, be it TikTok or Twitter, and they're just rallying you around their political division, like we saw in Tennessee last week. All of a sudden, you have Ben Shapiro on saying one thing, you have someone else saying one thing, then we need Dolly Parton and Taylor Swift to come on and put some reason into it all. It's just like, what do we do with this? Amy Klobuchar is putting through a bill right now to sort of once again look at revising Section 230. I've written about that myself in an op-ed in the Boston Globe about revising 230, but nothing seems to be changing. We're still in this same old pattern of misinformation in this sort of new era of media. And you're looking at it all the time. What's the way forward?
I think, I personally see changes, but I think there's an overarching kind of like rule, I guess, that is, misinformation is always there. It has always been there. We don't need the internet for that, right? What the internet adds at first is scale. And there you kind of like have the issue that basically for years, Facebook, YouTube, etc., Twitter too, like their business model was basically engagement and basically keeping people engaged. And this kind of like already fostered certain communities to grow. And so, yes, you can kind of like take aspects away of that, right? Like through content moderation. Now, basically, YouTube is rethinking its algorithms, et cetera, et cetera, et cetera. But the communities that have grown over those years, for example, on Facebook in the context of anti-vaccination groups, et cetera, they don't just go away, right? And so it's basically recognizing that basically just because Facebook and Twitter and YouTube are now doing, necessary steps doesn't necessarily mean that kind of like what they haven't done prior, but rather what they kind of like fostered causes to some extent damage. I think to some extent because obviously the scale is bigger and we kind of like have to look further than just social media platforms. But that's of course important.
Dr. Schnaffer, what do you say to that?
Yeah, well, I think trying to reach all different segments of the media is very difficult. I've been engaged a little bit on behalf of the National Foundation for Infectious Diseases in actually being on some very conservative radio programs. And most of the hosts are really reasonably genial, and we can have a reasonable conversation. I've been on one where a conversation really was very, very difficult. Tried it twice. I'm not sure I'll try it again because it's I'm trying to educate through the media, trying to provide good information and reassurance. And if I can't do that, no point in being on that show. I'll try something else.
And what about you, Peggy? You're talking to the media all the time. Are you talking to some of these sort of right and left groups? Are you talking to fringe groups on social media? Or are you just speaking mostly to the mainstream? And do you have thoughts on how we kind of shore up some evidence-based information into this system?
Yeah, we are getting calls from all kinds of sources, mainstream, people who are out there and have very unusual ideas. And our job is to really figure out whether this is something that's worth us doing. I have a lot of times when I ask somebody about whether they want to talk to this person or be on this show, I'll hear the comment, well, that's not news. And I find myself constantly saying, well, that's not our call. If this organization is going to be doing that, then it's news to them. And our question is, how do we respond? And I think that more often than not, we encourage people to get out there and provide the other side. Sometimes it works, like Dr. Schnaffer was just saying, but other times that people are so entrenched in a particular viewpoint that it's really hard to even get your views out there. And so, so what we try to do is figure out whether it is a forum that it actually would be helpful rather than embarrassing for the expert.
Right. I can see that, you know, as you say, Dr. Schaffner, you go on one of these programs and you're just sort of, you're not dealing with evidence. So, and you're just kind of being hammered because, you know, we've seen media companies that are trying to just enrage and engage to get more clicks. And I've got to think that's very, very difficult as experts.
Well, it can be difficult. Fortunately, most of the media opportunities that come my way provide an opportunity to make positive statements, to try to explain things, to put things into some sort of a context, to take federal bureaucraties and turn it into English so that it's more approachable for people. And I think keep trying to do that. It's I see it as an opportunity, whether longer conversations with the written media or very brief sound bites, to try to get a positive message across.
Peggy and Dr. Schaffner, have you been asked on to Facebook Live or Twitter Live or any of those sort of social media platforms to be heard and share your knowledge and expertise?
Not I.
Peggy, have you been asked?
We have not. I'm trying to think. There was some program that we did ourselves. That we did it through YouTube Live, but it wasn't something that we were asked to do. But we have not done that yet.
Do you think that would be helpful, given that you've both been on the front line of trying to educate people? If you were having sort of active spots on social media and getting into the social media stream with evidence rather than just on the mainstream media news?
Well, we do that. I mean, we have we're on Twitter and we're on Facebook, and we do some YouTubes with what we hope is good and helpful information. So we're trying to counter it a little bit that way. But
you're doing that, Peggy. You're doing that on your own MGH handle.
We're doing
right?
that
The way
on our own
GBH
MGH.
is doing that. Yeah.
Exactly.
Jonas, how do we? Jonas, how do we get these social media companies to use their algorithms to amplify some of this evidence? How do we, and the experts, how do we get them to play ball with this?
I think they have gotten to some extent better with this. Again, you have kind of like these grown communities that is really hard to get rid of. In general, I think there has to be a discussion, and my stance here is pretty clear, is that it doesn't really make a lot of sense for me to have recommendation algorithms, for example, on YouTube, right? Like the next video button on the right, or, like which just shows you another video after another video, when it comes to science or journalism for that matter. Right, like that has never really made a lot of sense to me. Why you would actually need another video and another video when you only want to kind of like be up to date, for example, about COVID, right? Or if you want to know something about the latest news. So my recommendation here would just like get rid of these, like autoplay video recommendations altogether, because if you can't guarantee that, like you're not also recommending
news,
yeah, that you're not only also recommending mis and disinformation, then you should probably like get rid of that feature altogether, because like that, then it's really like a cost benefit, like where you have to think about it. Generally speaking, I think it like, and that's obviously a hard discussion to be had, but it's always a question when experts go on certain shows, because there is always this trade-off, right? Like, yes, you might be able to reach some people, but also at the same time, you might legitimize problematic shows, right? That is on the one hand. And then, like I did my PhD in climate change communication, and that has been discussed there at for years now. And there's something that is called the information deficit model. And the general assumption is here that, like people would know what the right stance is and how to behave in this context about climate change, but I think it exactly fits to COVID as well, if they had the right information. And that model is just, wrong, because we know that there are a lot of aspects that play into why people behave the way they do, what they believe, when it comes to science that has nothing to do with knowledge, but really has a lot to do with identity, to their backgrounds, et cetera, et cetera.
But if we're going to, I know you wrote a paper on vaccines recently, and you had studied in your PhD climate change skepticism. If we can't just put the knowledge out and have the public know that there's some like trusted streams, some reliable institutions, that the word expert is not liberally used, that you have to actually earn that expertise. What, you don't think that alone is enough on social media?
Not in general. Like the bigger issue, right? Like if you assume that COVID would be non-politicized, I think we would have a very, very different discussion. The problem is it has very much become politicized. And so the question of who you believe in is an extremely political discussion. There's been just a paper been out that basically looked at who do Republicans trust when it comes to vaccine information. And what the authors tried to do is here compare if they, they tested whether the information comes from a Republican or from a Democrat. And Republicans trust vaccine information more if it comes from a Republican, right? And that's kind of the issue at play here, that it's already politicized. And so there are no clear neutral bodies, or very few. And so everybody who kind of enters that arena, as a lot of epidemiologists, virologists, medical doctors have experienced over the last 1.5 years, you'll immediately will come into kind of this political arena and will be exposed to criticism from one side or the other.
So how do we as academics, doctors, healthcare workers communicate our findings? And any of you speak to that. Jonas, you can go first, or Dr. Schaffner, Peggy, jump in, because this is what I study at Harvard. We're in the Future Media Project at the Institute of Quantitative Social Science, and we're studying right now, how do we get evidence into the newsfeed in a very simple way? And if Jonas is telling me it doesn't matter because they're not going to trust you unless you're, in their niche community, how do we get this academic knowledge out there? We're living at a Renaissance time with some of the brightest minds in the most innovative country. And how do we get this information out there?
Well, Heidi, let me start by saying, first of all, you've got to put it into a communications form in language that people understand. And
I'm with you.
So you've got to talk to the high school level. How do you talk to your Aunt Susie, who's not a professional? And so you've got to stop using the 50-cent words and use the 10-cent words, which is very hard for many of our scientific colleagues. And then if you're trying to change behavior, besides just providing information, then as Jonas says, you have to change attitudes. And there we're going to need colleagues to do that. It's not just getting information out there. Some of the most trusted people who influence, for example, COVID vaccination decisions are friends or a religious leader. At times, the local doctor, the family doctor, yes, he has the prestige of being the doctor, but he's taken care of your family for the last 20 years. So you trust that person who lives in the same community that you do. If you're a member of a minority community, you would like to see someone who looks like you and communicates in a similar fashion. So Bill, who's a white guy, is not always the best communicator by far. We need people who help us when we're trying to translate our best information into public policy and into behaviors. It's not just expertise by any means.
Well, I'm excited. Sorry.
And if I can add to that, it's not just one way. You can't communicate on CNN or get an article in the Boston Globe and say, okay, well, we communicated that. Everybody gets information from different ways, in different ways. And I think that we have to be very sensitive to that. Most of the patients, most of the COVID patients and families who we saw in the beginning were from the Chelsea area. And there's a lot of different languages that are spoken in Chelsea. And we had a lot of trouble communicating with them. And so we formed a Spanish language care team that could talk to the patients, could talk to the family members. And so as a result of that, we have a lot of people identified who can communicate in communities where they may have trouble getting the information that we think everybody's getting because it's in the Boston Globe. So we're on Telemundo, we're on different places where we can reach different populations, different vulnerable populations, and we can't assume that you do something and everybody gets the message, because that just doesn't happen.
Right. Well, we talk about that a lot. Meet people where they are. And fortunately, we have some young people who are going to come on, and that is where they are. And stat I love right now that came out of the Reuters Oxford Institute is they did a study on where people were getting their news, and the under 35s. You ready for this, everybody? Out of the under 35, 60% are now likely to get their news and information from search and social media. So that is why I ask, has Twitter, Facebook, TikTok, YouTube invited you on? Because that is where the kids are. So I'm going to start with the first young student. Jerry Gendall, a political science student at Suffolk, is here to ask you a question.
Thank you very much, Heidi. My name is Jerry Gendall. I'm an incoming freshman at Suffolk University, majoring in political science. I'm currently calling from Arlington, and my question is for Dr. Schnaffer. Pandemics are a common occurrence in human civilization and are becoming increasingly frequent for a variety of reasons, such as global travel, urbanization, and climate change, among other things. How predictable was the COVID-19 pandemic coming from someone with an expertise in infectious diseases? And furthermore, from your perspective, what did we do wrong in our initial response?
Jerry, thank you for your question. Most of us think because the world's population is expanding, because it travels and communicates with each other so very much more frequently, this expanding population is moving more and more into parts of the world, usually forested, that was more remote, which is where these viruses in animal populations originate. That's their reservoir. And so we anticipate that periodically there will be other pandemics where these animal viruses find their way into the human population. Now, what I cannot tell you is which virus, when it will happen, and from where it will originate. But I can guarantee you that there will be future pandemics. Now, the second part of your question has to do with what did we do wrong? I didn't realize that this was a 5-hour program. But let me say this, because we're talking about communications. If prior to COVID, you had done a survey and you had spoken to infectious disease physicians and public health people, what's the single most important part of the response to a pandemic? I think most of us would have said in our first 3 things, communication, communication, communication. Sustained, clear communication based on science, translated into coherent public policy, with our political leadership standing behind the public health leadership, which was making the communications. Not to put too fine a point on it, we did just the opposite here in the United States. There were other countries that did a much better job with that. We'll start there and leave it there for the moment.
Do you want to give any shout out to any of those countries?
Well, in Australia and New Zealand, for example, they did it very well. In Australia, it is my understanding, the political leader, the prime minister, went to his opposite number, the leader of the royal opposition, and said, listen, let's put politics aside. We're going to work together and produce the best possible national response to COVID. And we're going to do it on a nonpartisan basis. And once we get that settled, we'll go back to our political corners and come out and duke it out. And you know what? They did that. New Zealand, clear prime minister, public health-based communication, did things very, very well and communicated in a sustained fashion. They were really the best models I can think of. There are others out there.
Nice question, Jerry. Thanks a lot. The next student is Yannicka Ruin, and she is a business student and she has a question for you too.
Thank you, Heidi. Hi, my name is Jenica, and I'm an upcoming freshman at Suffolk University as an intended business major. My question is for Professor Kaiser. Media is an epicenter of opinions and facts melded together, all with different biases. We can't train everybody to spot dis or misinformation, but there are some things we can do. You touched up on the subject a little bit, but my question for you is, what does responsibility for individuals combating that and not spreading harmful information look like?
Thank you, Jenica. That is an excellent, albeit very difficult question. And I think the classic response, or I think the answer that a lot of people would expect here is obviously, like, if you be critical when you get news and fact check. And I'm not saying that that's wrong, because it's not. Of course, like, if you are there, fully there, those are very good steps to take when being confronted with news. I think there's an aspect that is kind of like behind that, and that is kind of like deals more with attention and how we kind of like navigate the internet, and what our personal lived experiences online are. And I'm not sure how you do it, Jenica. Like I'm sometimes more there online, and I'm more aware of the information that I'm kind of like exposed at, and sometimes less so. And I think that's kind of like more where we kind of like have to understand that occasionally we might have some habits of when we browse the internet where we're more vulnerable to misinformation than on other times. Or maybe that, like, it's not the most healthy way to kind of like consistently be on TikTok and look for certain information on TikTok, but rather because the medium doesn't lend itself to kind of like longer information, et cetera, like being more, like critical with our own media habits of what we search on what outlet, and kind of like think about that. Because generally speaking, like if we are being exposed to a media source, or, like a scandalous website or whatever, then of course it's always good to fact check that and to kind of like, be mindful and critical of that. But usually there have been several steps before then that kind of like led us down that path, if that makes sense. And so I think, I'm more thinking of a holistic kind of like how we get in touch with information, be it from news sources, be it from our friends via, TikTok or Snapchat or YouTube, and to kind of like be more critical of our behavior there. Because, like in the end, we kind of like have to be careful of what we see, and we have to be careful of what we share, right? And I think those are the two aspects. And if we kind of like are careful about the first one, I think we don't have to worry that much about the second.
Thank you, Jenica. Did that answer your question?
Yes.
The next student is Gilad Gerber, an undecided at Suffolk. Gilad, welcome, and your question.
Thank you, Heidi. My name is Gilad. I'm calling in from Gloucester. I'm an incoming freshman at Suffolk, and my major is currently undecided. My question is for Peggy. The nature of scientific inquiry is to be thorough and in-depth, which can take a lot of time. Social media inherently undermines this, encouraging present-focused conversations and rapid-fire conclusions. For example, while there isn't yet a definitive answer to the lab leak theory, many have already made their own presumptions, which has led to seeking misinformation rather than waiting for a reliable source. My question is, how do you, as a public affairs professional, navigate through the torrent of news and data sets in order to know whether or not we can be certain about something, or if we just need to wait a little bit longer?
Thank you. That's a great question. So we do have to be aware of what is out there and what people are talking about, and what we might need to respond to. So, where the virus came from was certainly something that a lot of people weighed in on, but nobody really had the definitive information. And so it led to a lot of speculation. I remember another example of, I think it was a study that came out that just talked about the potential of those with COVID-19 being more at risk of developing Alzheimer's. later. And I loved one of the stories that I read that didn't try to answer that question. It just basically said, can COVID cause Alzheimer's? Here's what the researchers know so far. So they weren't trying to promise any answers to that question, but they were providing information that was, the latest that science had to offer. And I think that's what we try to do as well. We don't try to answer questions that aren't answered. And I think that the people who are talking about COVID who do the best jobs are really recognizing that this is such a dynamic situation, and that we don't have all the answers, and that you need to expect changes. And so that's what we try to do. We try to get experts to respond to those kinds of questions. We try to keep up with what the latest headlines are and what we might be asked to address. And then we try to find people who can be very reasonable and measured in what they say, and not try to answer the questions, but try to provide a context in which people can look at the question and a framework in which they can sort of evaluate it for themselves based on their own perception of risk and their own outrage about whatever the issue is.
Jerry and Jenica and Gila, those are really good questions, I have to say. They took this in a direction I'd hoped we'd go. The next student is Christina Priest. Christina has a question. She's a communication student.
Thank you, Heidi. I'm Christina Priest. I'm calling in from Lowell, Massachusetts. I'm going to be a freshman this upcoming fall, and I'm going to be a communications major. My question is actually for you, Heidi. I've done some research on your work with you've talked about people need to be able to have faith and trust in what they may be listening to or reading. And I'm really curious to know how you feel about media manipulation of their emotions of their consumers, and to what extent it is being done to push a certain narrative.
That's a good question, Christina. Congratulations on being a freshman this year. Good thing you waited a year. I hope you're going to you may still be under a mask, but hopefully you'll have a bit more freedom than the freshman last year. Congratulations. Trust is a really tricky thing because we've discussed tonight, a lot of people trust their social trust network. So is it your family? Is it your religious group? Is it your neighbors? Is it an expert that you like? Is someone who looks like you? And I think that news did fail society as society changed quickly, and there weren't just sort of white people and Black people in the country, but people of many color and many backgrounds. And we didn't move fast enough in newsrooms to diversify that journalism core. And I think that that is something that maybe journalism can wear as one of their challenges. And I think they've taken huge strides at trying to fix that. And I'd like actually Facebook and Google give out a lot of money for journalism, and they give it to a lot of silos. And I understand why they were doing that. They were trying to have more people representative of everybody in our community. It also is useful to them because it helps them target and and organize their content. And but I think that what I wish now is when Facebook and Google give money out to journalism, that they would start to demand that the entire newsroom be diverse from the top to the bottom. And I think that will build some of the trust. I've been very vocal about this. I believe that newsrooms should have everybody in them together. I don't really want to be in a newsroom of just like white women in their 50s from Cambridge who are straight. Like, how interesting is that? That's not. And so I think that we need super diverse, large newsrooms where there's mentorship. And I think that in that, I won't worry so much about that behavior challenge, which I'll answer as well, because you'll have a diverse newsroom. And I think the Boston Globe has done a very good job at trying to do that. We're very lucky to have the Boston Globe and GBH and BUR in this city. We have 3 amazing newsrooms who have all worked hard at increasing their diversity. And I think we need more of that across the country. And I'd like some of the legacy news to adopt some of these digital upstarts so that we can bridge everything together. And once you have a robust newsroom that believes in the tenets of journalism and has some mentorship, I think that the quality of news that will come out of those newsrooms won't be focused on your behavior so much. You know, when I went to journalism school in 1994 at Concordia University in Montreal, I did my graduate studies and I did my undergrad in comms like you. And we didn't even think about how we were going to enrage or engage. I mean, if it bleeds, it leads is certainly a line in journalism. So if there's a fire or someone's dying or there's a pandemic, it's going to be the breaking story. But we were focused more on getting to accountability and truth and being skeptical. We weren't so focused on trying to trick your behavior and incent your behavior. And I put that blame on the social media companies. For people that may not know, that's how they make their money. They micro-target all of the things that we do. And I love technology. I love it. I'm not anti-technology. But when you use the map or you tweet someone or you WhatsApp somebody or you like a certain story, you read something in a newspaper, it's tracking you and it has all of your behavioral information. And it's the platform companies that are using that to target and advertise to you. Twitter pulled down ideological and political ads halfway through the last election. I wish the other ones would do that. I always say, look, we have to have revenue. We're a capitalist society, whether you're a newsroom or you're a tech platform, you know, you've got to have some revenue. And the internet is a wonderful thing and it has to have a revenue model. It has $1 trillion now in many of these companies, so they'll be fine. But I think that we need to have that conversation. I'm glad you asked the question as a society, and especially your generation. You kids need to ask, do you want to be micro-targeted? How much is your privacy worth to you? You know, my own kids who are teenagers, one is at Tufts and one's in high school, and they're like, I don't care. I don't care that they're following me. But I think that you should care. You should care about your privacy. And I always say, I don't mind if they want to sell me a trip or a car or a pair of shoes or some certain fancy new food. But when they start to play with my behavior, I don't think that's okay. And I think we should have some regulation around that. Does that help answer the question? I know it's a long-winded way.
Yes, thank you. That helped very much.
So we have, wow, I'm not used to being the one asked. Thank you for that, Christina. We have more questions on the floor. And so I'm going to read a few of them for us. This is to Jonas. I think you can read it with me. Jonas, in a set of tweets, April 28, 2021, you referenced data on American and German articles, I need my glasses, and how commonly they favored a vaccine. So German and American articles commonly favored a vaccine. Do you believe there's a bias within certain countries of how effective vaccines are? Why is it that the one vaccine is favored over the other when the focus is for everyone to be vaccinated? Is money involved?
Yeah, so for everyone kind of like who hasn't seen that, you know, like thread, which was really more like me thinking through some aspects that I, you know, like observed as a German citizen who's living in the US and where, you know, like both consume German as well as American media. And kind of like what I was looking into, you know, just like very descriptively, was how frequently are different vaccine manufacturers being mentioned, right? Like the immediate example here, of course, is that when I asked my students last semester about like who knew what BioNTech was, that most of them had never heard of that, right? When in fact, you know, like the Pfizer vaccine was developed by BioNTech and then in cooperation with Pfizer distributed and produced, of course. And basically what I was interested here just is, you know, like really to see, is that being reflected basically in the media coverage, both in Germany as well as in the US? With like the result, yeah, in Germany, more articles talk about BioNTech than Pfizer, while the opposite is true for the US, where most articles just refer to Pfizer, whereas BioNTech rarely gets a shout out, right? And then I kind of like also looked at AstraZeneca, which was, you know, more popular, for example, in Britain, et cetera, et cetera. And I think, you know, like I can't specifically say why that is, you know, like that was just like, again, for me to kind of like to see whether my observations were true or not. But I thought what was interesting, and this goes back to kind of like what Dr. Schaffner and Peggy Slasman also like said, are, you know, like basically is about trust. That's kind of like where I landed in the end. That basically in German media, it works better if you kind of like reference the German company, Whereas in the US, it works better if you reference Pfizer, which is just like a well-known company, whereas most people probably don't know, or certainly don't know, BioNTech. And, you know, like that is a way to reduce kind of like skepticism, because you've already heard of Pfizer. And so it's, you know, like, why would you then, and that might, you know, like make you less hesitant about getting the shot than if it says, it's a BioNTech vaccine. But, you know, like there's obviously then also something about like vaccine nationalism. We also know, for example, or we've seen to some extent that Russian hackers also were involved in kind of like trying to push, you know, like criticism around like, for example, the BioNTech Pfizer vaccine while promoting the Russian vaccine and all that stuff. So there's also just like a lot of, you know, like in these operations, there's also money involved, right? Because in the end, that's just like a big game, but that was not the goal of, you know, like my little exercise there on Twitter.
We have lots of other questions. Thank you for that. I'll go to Dr. Schnaffer for a moment. We have a question from someone in the audience. Adam would like to know if there are any long-term impacts that people can expect to see after the pandemic in terms of how we communicate with one another in political and social settings. And another one, Dr. Schnaffer, so you can choose which one that you take first. That someone is looking for an example of a success story where you turned a vaccine denier into a vaccine believer. So maybe do that first, vaccine denier to vaccine believer, and then tell us if you think there'll be some long-term effects and how we communicate with one another politically in social settings.
Well, there have been several instances, Heidi and Adam, where I've been able to converse with somebody who had a very specific concern. For example, there were people who were concerned about potential long-term effects of the vaccine. They were, and by long-term, they meant occurring 2 years later, things totally unexpected. And they were very surprised to learn that of all the many vaccines that we give to children and to adults here and around the world and have for 60 years, none of those vaccines, none, have any long-term effects. And there's no reason to believe that this vaccine would have a long-term effect. And then we talked a little bit more about how side effects are determined and we do surveillance for them. And those people were on the fence. They had a very specific question. I was able to discuss it with them and they decided to get vaccinated. There've been other instances that I've heard of where family members finally persuaded another family member, usually on the basis of making things as safe as possible within the family unit so that everyone's vaccinated and therefore the entire family is protected. So it varies with person to person. As to long-term effects on communication, I think some of the lessons that we have learned, I think will stay with us. A lot depends on the circumstances. If we have another pandemic, as I was asked just before, a lot depends on the political structure and the public health structure that's in place regarding the nature of the sustained communications. If we go back quickly to the 2009 influenza pandemic that we had, the then CDC director, acting director was Rich Besser. He had media experience as well as being a terrific public health physician. And he did wonderful jobs in communicating. But at that time, the political leadership stood behind Rich and let Rich do all of the communicating. And although the message changed over time, as we learned more, there was a great deal of confidence in those changing messages that came from a valued source.
I love that because it leads right into another question to, it says to Dr. Schnaffer, Peggy, and I think Jonas, you might have something on this too, which is, oops, it's jumping around me 1 second. How optimistic or not are you about actually getting the message that you need to at this point after 18 months of being under fire? Do you still have optimism that skepticism, hesitancy, and maybe even outright mistrust can be overcome by good communications and good public health and science?
We'll let Peggy go first.
Well, I was I was talking when we were planning this. I was saying that one of the things about this that I find so interesting is that, you know, people who believe that you should get vaccinated because that's the best thing that you can do to really end this pandemic pretty much have done so. The ones that are either totally against being vaccinated, you probably will never get to them. But then there are a bunch of other reasons that people have not been vaccinated. And so, you know, to pick those off kind of one by each, I think we're almost at that level right now in this country. So is it because of a language problem? Is it because of an access problem? Is it because of a mistrust problem? And you really need to be where they are in order to address that. So I actually feel that that we can get a little bit further by doing some of these things, but there are, I don't think we're ever going to get to 100% because there's just too much mistrust.
Do you think can you understand why Canada got ahead of us? They sort of had this hockey stick. Their sort of number is higher than the US now.
The percentage.
Yeah. Do we know what that is? Anyone want to hedge a bet?
Well, we didn't get off, as Dr. Schnaffer said earlier, we got off to a really bad start. I mean, that we didn't communicate well. And I think that it led to a lot of questions, a lot of concerns, a lot of confusion. And I think that it's taken us a while to get back on track to have, you know, and I hope that we're doing a better job now with the public believing what the public health officials are saying, and letting the science be the thing that really drives the message.
You know, I could go on and on. We're going to have to wrap up. I have a question for Jonas, and then we'll go maybe back to the whole group, which is, what would you suggest to the younger generation who rely on social media to stay informed? Should we only read the news and refrain from our social life? What is a healthy balance? And I guess the question you and I will both ask, Jonas, from what we study is, you know, what constitutes news?
Right. What constitutes news indeed. But, you know, like generally speaking, I would say it really depends what platforms you use and for what purpose, right? What are you using TikTok for? What are you using Twitter for? And to kind of like, you know, take a moment and think about like what you want to get out of each of these platforms. Like basically, if you want to use TikTok for news, then it's probably not the best choice of platform, just how the platform works and kind of like, you know, like how much space and attention span you have there. But of course, it's great for, you know, like serendipity, and it's great for entertainment, and also to stumble about like, you know, informational tidbits, etc. And so, you know, like at the same time, you can use Twitter, you can use Reddit to kind of like get some news that is especially kind of, you know, has a lot of news values and use whatever that then means, and often can also mean clickbaity. And so, you know, you don't obviously can replace, you can't really replace, I don't know, a newspaper, a news site, a podcast, however you want to get your news from, right? Like journalistic news. And, you know, that you can't replace that with, I don't know, Twitter or a Telegram group or a TikTok channel. And I think that's kind of like needs to be clear from the get-go. And, you know, like don't try to replace that. You know, but apart from that, it's obviously fine to get some news from Twitter, to get some news from TikTok or Reddit.
It's funny, I've been using a metric lately, Jonas, tell me how you feel about this, that I try and see how many actual paid journalists there are in a newsroom and if there are mentors. Not that, you know, like a whole bunch of young kids can't do a great job, they can, and that's the future. But I kind of think, how many paid journalists are there in that newsroom? When all of you are looking at the next few months, I'm sort of bummed out to think we're going back into mask life, and certainly the kids going back to school with masks this fall. Do you have any hope for us on where things are headed? Maybe each of you just give us a wrap up on what you're hopeful for and how you encourage us to get through this next bump. Peggy, you want to go first?
Well, I guess what I'm most hopeful for is that that we will have created with this sort of Delta variant that seems to be rearing its ugly head throughout the country, that people who maybe didn't take this as seriously as they should have will realize that this is a problem. I don't want to wear this mask anymore. I want my kids back to school. We need to be done with this, and we'll actually maybe take it a little bit more seriously. I remember seeing a news story last week about a person who was very much an anti-vaxxer who got COVID and died. And as a tribute to him and to educate those who knew him and came to the funeral, they actually had a vaccination center, site set up at the center, and they wanted people to get vaccinated as a tribute to this man who was dead set against vaccination. And then, that sent a pretty powerful message. It's tragic, but it sent a powerful message. And I understand that a lot of people at that funeral did get vaccinated. So I do think that there's, it's going to be slow. I think it continue to be slow, but there are things that can be done that can maybe turn the tide a little bit. So I am hopeful that things will get better.
And we're all in this together. That's the thing.
We're all in this together. Absolutely.
Dr. Schaffner?
Well, I'm an infectious disease doctor. Infectious disease doctors like to cure patients. And I'm also working in public health, and public health is dedicated to social justice and providing a healthier environment for everyone. So those of us in those disciplines are optimistic, right? And I am personally optimistic, but I've become a bit more guarded in my optimism because I didn't think we would encounter so much resistance, indifference, and real stubbornness about vaccination quite as soon as we did. And I find that sobering, but I shall soldier on and do my best and maintain my optimism going into the future.
I hope you know how grateful we all are to people like you and Peggy who've been out front. I find it very emotional. I really appreciate it. It's taken a lot of people to pull us through this, and a big thanks to both of you for your service. Jonas, what do you say? Is there hope? Should we live on our phones?
I mean, always, no? I mean,
I like to think so.
I would like to think so too. And I think there are hopefully some lessons to be learned from the last 1.5 years, both for social media companies as well as journalism. And I think at the end of the day, it's also always important to note that most people want to do the good thing, right? And they kind of don't want to hurt people. And while, especially, and, people that are hesitant or anti-vaccination, while it's sometimes hard to kind of fathom some of the arguments that are being leveled and that are being, entertained, it's always important to note that, people believe that. And I think that's kind of and this was basically where we started off with Dr. Schaffner noting to kind of talk to them on that level and kind of try to reach them there and kind of try to find a consensus on how we can move forward. And I think, we can always offer a hand and we might go from there.
Yeah, that's hopeful, you guys. I really hope that we can stop being divided, because we are all in this together. We don't need to lose any more people. And everyone wants to move forward, want to get kids back to school, get everybody moving forward. And you see it when you're out with people, people aren't all back together yet. People are tired and people are a bit shaken and people have lost people. So I'm optimistic. I hope that we get through this Delta bump quickly. If any of you have any insight you can give us on how long that's going to take, this is your last chance. And then I'm going to turn it over. Do you think is this going to be a long few months?
Well, I would say very quickly that this virus is not going to disappear. We may be able to control its transmission and reduce its transmission substantially. That should be the goal. But the virus is now part of our microbial world, just as influenza is, and we'll be coping with it into the future in one way or another. And I hope we can do that in a coherent way to minimize the impact that this virus has on our population.
Well, thank you all. Really appreciate your time tonight, and feel very lucky to have you all here with us tonight. I'm going to turn it back over to Christina.
Thank you, Heidi, and thank you to our amazing panel. What a great conversation, and certainly a really timely conversation. Our producer at GBH often says that these episodes drive change, and I hope that that is the case here. One anecdote, you all say you'd like to think and hope and be optimistic that change is going to happen. That's the first thing that I said to a judge when I got my first speeding ticket. I'd like to think that I wasn't speeding. He let me off with a warning. So my hope here really is that this conversation will drive some change, will be used for good, and will make people think and make people be curious. And I think back to other big mandates or public health decisions that seemed controversial at the time, like seat belts. That seems awfully benign now, but everyone has changed in terms of culture over time. So again, we're back at this nexus of changing culture, changing behavior, and communication. So thank you for all sharing your expertise with us tonight.